Good evening, everyone. My name is Aditya, and I'm a co-founder at Plus91. So we are a 15-year-old digital health company, and we generally have done large integrated rollouts, and patient record interoperability, as well as patient engagement, is at the core of what we do. It's something that excites us. In fact, it excites us so much that when the NHA, or the National Health Authority, released the Ayushman Bharat Digital Mission interoperability framework for patient records, we were the first full platform to get certified across all milestones. Not only that, we have live customers using various components of the interoperable framework, scanning a QR code to share their demographic information with the hospital system. We are working closely on the UHI, which I will touch upon in detail. We also have a health locker where patients can store their records coming in from multiple platforms. Right. So integrated decentralization, why is it needed? So in most developing countries, you would find that resources are limited, right? There are too few beds or doctors. There's a disproportionate spread of facilities. And even with the limited resources, you would find that they're usually underutilized. In case of the developed countries, you find it quite the opposite, which also India has a foot in. So you would find that healthcare costs are going up. There is reduced availability because people are building moats around the frameworks that they have built privately. And this also ensures that quality could be compromised by people having vested interests. There are siloed efforts being done in interoperability. We have a few projects. We are doing a Ghana in Africa, a national e-health rollout. Over there, we have ensured that patient record portability. They are at one hospital, they go to the next hospital. Within 20 minutes, their record is available there for the doctor to continue, and it has improved patient outcomes. We also have a mobile medical unit application, and they are at the very core of decentralization. They move around. But how can you pool that information centrally so that they decide where to go next? Are they carrying the right medications? In India, there are other initiatives like the e-Sanjeevani initiative, over 90 million teleconsultations done. And this has optimized public doctors' time to ensure when they are free, they can actually do a teleconsult. We also have doctor discovery platforms like Practo and Librate, who have helped find doctors at least in Tier 1 and Tier 2 cities. So what we need to do and what the government is doing along with the National Health Authority is actually democratization of healthcare. Consent-based availability of information to the right stakeholders. So they started with the first step, which is identification of the stakeholders, whether it was through Aadhaar or building registries for health professionals as well as health facilities. The next was patient record portability through ABDM, right? So patient record could flow from one provider to the next, ensuring improved outcomes. And now they have moved to service discovery, which is the UHI, based on Beacon protocols and their decentralized health protocols. And finally, pooled anonymized data, which is the holy grail where we can start making large public health decisions. So what is UHI? UHI is basically the ability for a patient or a person to use the app that they are using to find services online across various providers. And this could be for multiple things, whether it is for blood, searching for blood, ambulance, or doing a teleconsultation. So this is what we want to do. We want to change the way it interacts. Today, it's my platform. It's being used by a few hospitals. I have maybe a tie-up with an insurance company or with another patient-facing app, and they could book appointments with just my hospital. And on the right, you'd see what a UHI framework would look like. And I know this is a very commonly used same diagram repurposed by everyone to make sure that this is basically for healthcare. And a typical flow would be, imagine a person sitting 200 kilometers from Bangalore. He's done an X-ray. He finds out that he needs to see a neurologist. The doctor at the health and wellness center says you need to see a neurologist after looking at his record on ABDM. He goes back and using his Paytm app he actually opens up the health model, and then he can look for any neurologist he wants at the right price point and availability anywhere across India. So sitting at his home, 200 miles away, he can still look for a doctor across. And imagine the same person traveling with his friend to Rajasthan. He's in a tier 2 city, and his friend has an accident, and he wants to look for an ambulance. He can use the same app and look for an ambulance there without having to change his behavior, or go on Google to find the ambulance services, or look for the hospital and whether it's going to come. He can track, book, pay for the ambulance. So the main thing is that it is leapfrogging consolidation that happens otherwise, right? Otherwise, you would have people doing tie-ups, collaborations, building moats, but you can actually leapfrog slow mergers and partnerships to create an integrated and networked environment. Something like, to quote Oscar-winning movie, everything, everywhere, available all the time, right? It also gives us the ability to maximize resources and provide an ability to reinforce healthcare services, especially in disasters, from one location to the other. What will push adoption faster, something we saw just back there, improved phones with sensors, allowing people to track more information about themselves, improved connectivity, a change in mindset. The younger generation is willing to do more online, and adding certain low-hanging fruits which are already digital in nature, e-pharmacies, home care services, number of people who want to find a nurse tomorrow or day after for someone who's fallen sick at home. Plus91, we are willing to commit to integrate. We are making sure that we are always compliant with standards so that we can integrate more and to help out others in this digital health journey. What I would like to leave you with is that as an individual person or as a private company, we can definitely solve any problem in healthcare, but working together, we can try to make the problem disappear. Thank you.
Thank you so much for that wonderful presentation and explaining also how you're using interoperability and backend protocol as well.